Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Role of luteinizing hormone granulosa cells. Here there is increased luteinizing hormone. The luteinizing hormone will act on the granulosa cells and thus it causes luteinization of the cells. Whenever there is luteinization of the cells, a small amount of progesterone is released even before ovulation. This small amount of progesterone at the time of LH surge which is released, it has positive effect on luteinizing hormone and follicle stimulating hormone, and thus this progesterone will increase the luteinizing hormone and follicle stimulating hormone.
So on LH, the granulosa cells converts into luteinization of the cells. That means the granulosa cells will become activated and some chemical changes occurs in the granulosa cells, resulting in luteinization of the cells.
In females, luteinizing hormone receptors are present on theca cells and granulosa cells. This progesterone appears earliest in the menstrual cycle at the LH surge. That is, progesterone appears 32 to 36 hours before ovulation. LH surge and FSH surge also occurs before ovulation.
But before LH surge and FSH surge, first progesterone surge will occur around 32 to 36 hours before ovulation.
thank you and thank you for watching.